I'm joined here today with Dr. Matsumura, board certified sleep physician, menopause expert, and founder of the Dream Method, known as the Sleep Goddess, which I absolutely adore. We are going to chat all things sleep, menopause and sleep, and hopefully provide some practical help for women out there. Welcome today.
Thank you for having me.
So let's start at the very basics. Menopause causing it or sort of exacerbating some sleep issues?
Menopause exacerbates sleep issues for a lot of people. So we're able to compensate. Our bodies are really great at compensating deficits. But at some point, and it's typically in midlife, those compensatory mechanisms, they pretty much the scaffolding, which is our hormones, will change, and that then changes our ability to compensate for the inability to get to sleep or stay asleep. And so then we're faced with having to go back and retrain our brain and also understand how those deficits are impacting our sleep.
And is some of that related to bad practices that we could maybe get away with in the past and now, it's just come to a head?
Yeah. So, that's right. We live in a chronically sleep deprived society, and many people are able to get away with not getting enough sleep. And then we hit this stage of life, and all of a sudden we can't bounce back the way that we used to. And we have to change some of those habits or relearn some of those habits, because most of us as children have pretty good sleep habits. And if you have children, you know very well how strict you are typically with your child's bedtime routine. But we're not that good to ourselves when we become adults, and we lose some of those habits. And then we wonder why we can't get the sleep that we are trying so desperately to achieve.
Yeah, it's very interesting how we all sort of start to revert back to things we did in childhood as healthier ways. And definitely sleep is one of them. I'm thinking about, that early bath time, the winding down, not getting them too hyper, reading that storybook, rubbing their back, and then think about what, some of the things that I know I'm guilty of doing. And some of the big symptoms of menopause that can impact your sleep, not so much the, ability to fall asleep, but the staying asleep, these night sweats, hot flashes. We used to think that they were pretty benign things. And so is there any evidence around, the long-term implications of these with sleep or just sleep in general on our health?
Yeah, definitely. So when we have these shifts in our hormone levels, especially estrogen, that really affects our ability to thermoregulate at night. It makes our environment, it's uncomfortable when you wake up with night sweats or these hot flashes. And then that does not allow you to have sustained sleep. It causes a break, all these little fragmentations of sleep. And then you're unable to really get that deep REM sleep or sustained sleep, deep sleep and REM sleep, because you're having all of these middle of the night awakenings. So that's estrogen's role in the breakdown of sleep. And then progesterone is really helping us set the stage for calm. It allows us to kind of get into that relaxed state to get to sleep. And so then a lot of women will find that they're having trouble getting to sleep all of a sudden. And estrogen also really helps to support the soft tissue structures at the back of the throat. So there is this uptick, this increased risk of having sleep apnea in midlife.
And so we know from the research that, menopause hormone therapy can help with sleep. Do we know anything about, I'm going to probably guess no, but around that prevention of the physical changes to the esophagus?
Yeah, we do. Well, it's all the soft tissues
The soft
around the
tissue.
esophagus. Yeah. So we don't have any data that says that if you take hormone therapy, menopause hormone therapy, that you effectively cure yourself of sleep apnea. Now, and having said that, we're replacing small minimal levels of progesterone.
Right.
We're not going to get
Yeah.
to any type of level where suddenly we have this change in our tone. So I would caution, that's a word of caution to say
Yeah.
that because you're on hormone therapy does not mean that you no longer will have the risk for sleep apnea.
Right. That's helpful. Yeah. So, like, we hear a lot about, that whole concept of sleep hygiene. So, no blue light, keep your room cold, do this, do this, do this. How much? So, for the skeptics that are like, yeah, yeah, yeah. And, you're kind of going
Mm.
about your busy routine and you need an extra level of motivation to really make sustained changes to your sleep hygiene. Like, you might
Yeah.
do it for a few days, it's going to fall off the map. Like, you have to have a very focused motivation and energy towards changing these habits. How impactful can sleep hygiene really truly be to helping our sleep?
So it depends. So a lot of people who have chronic insomnia have developed pretty elaborate routines around
Mhm.
preparing themselves for sleep. Chronic insomnia is not really about bad sleep habits. It's
Mhm.
about the hypervigilance and the hyperarousal in your sleep. Now, having said that, a lot of people say, I know I've done sleep hygiene, that didn't change anything. But when I have people start writing down when they actually get to bed and versus when they actually fall asleep or what they do that hour before bedtime, again, let's go back to how careful we are with the children's routines. When we really think about it, we're not as kind to ourselves. And when we start writing things down, we do see that there are wider excursions in bedtime and wake time than we like to admit.
Right.
So it's similar to that whole concept around weight loss. And you say, well, I eat pretty
Yeah.
healthy. And then when you
Yeah.
start writing it down,
Yes. Yes.
you realize, oh, I'm eating well, but maybe I'm eating too much, or maybe I'm not listening to my body cue that's telling me I'm full.
Mm-hmm. Mm-hmm. It's fascinating. I always say when it relates to some of these supplements or proprietary blends where, they just aren't researched and maybe there's a little bit of evidence for, say, an ashwagandha or something like that. I say, like, okay, there is a little bit of evidence if you want to try it, but please, by all means, let's be a scientist and like actually write down,
Right.
because our human recall is horrible. And,
Yeah.
we subjectively are like, this isn't working or this is working. So I love that you're sort of validating that, like, let's just kind of track stuff a little bit here. Um,
Mhm.
so important. So there's chronic insomnia. There's, just things about not being able to fall asleep. Why do our brains, and I think probably this is maybe a little bit more for women, even though we're exhausted, they just, you maybe lay down for a few minutes and then your brain just starts flying a mile a minute. What is that about?
Well, so for a lot of women, or men also, men have trouble sleeping too. But we, again, don't give ourselves that permission to fall asleep. And a lot of times when you're in bed, that's that time when you are not distracted. So then
Mhm.
all of these things will start to bubble up and infiltrate your sleep, and you have to put that aside. And so some people will just write everything down. They'll have a pad and paper, a pad and pen right next to their bed, and they'll just write all those things out. It's kind of like a little data dump.
Yeah.
And really, you have to tell yourself, it sounds silly, but you have to tell yourself, you are not allowed to think about all of these things right now.
Mhm.
You can think about them at 3 p.m., not at 3 a.m., or not at 10 p.m. when I'm trying to get to sleep.
Yeah.
And then writing them down really, really does help.
Yeah. And then when we think about, like, there's just curious about your perspective on, there's a lot of evidence for cognitive behavioral therapy to help with sleep.
Mhm.
And so maybe you could just walk us through a little bit about what that even means and
Yeah.
how it's impactful.
So, when we think about chronic insomnia, by definition, that is the inability to get to sleep and or stay asleep, and it is happening 3 times or more a week for 3 or more months. That is the definition of chronic insomnia by the International Classification for Sleep Disorders through the American Academy of Sleep Medicine. And so, cognitive behavioral therapy for insomnia has been studied. It is a behavioral intervention that helps you retrain your brain to fall back to sleep. And again, I will use that analogy of children. Children there's sleep training.
Mm-hmm.
So we're doing the same thing. We are resetting and retraining the brain to fall back to sleep. So it is not a quick solution.
Right.
It does take a little bit more time, but it does have a high success rate.
Right. Right. And then as we switch into the medications, we're in a world of let's take a quick pill, quick solution, and just keep going. And there are the new DORA drugs on market now that, claim to be less groggy and have side effects. But, what's your sort of position or thoughts around, I guess, sort of those traditional sleep medications, and then maybe, using those over-the-counter tricks like antihistamines to just get a sleep hit?
So we do not recommend any prescription medication long term, because it ultimately isn't going to get you into the right sleep stages. Now, the evidence around DORAs, that's newer evidence. It's only been out. I think the oldest DORA is a little over a decade, but the data around the long-term effects, they're only about 5 to 6 years old, that published data.
Right.
So we still have some ways to go. But again, do we want to be wed to a pill to have to make us go to sleep?
Yeah.
Right.
Yeah.
So, I'm not opposed to taking medication short term, but you have to know exactly why you're taking it and write it down. I tell people, write down what you're trying to solve. And then after a couple of weeks, is it improved? And you need to do cognitive behavioral therapy with the sleep aid so that you can eventually get off of the medication. I try not to use them, but for some people they come with on them already. So rather than just stopping them cold turkey, let's give you some confidence, let's give you some tools, but have a plan to sunset that medication.
Yeah. And then I'm assuming similar perspective on supplements. Like, well, let's actually just talk about melatonin. And I was listening to a podcast by Huberman a while back, but he had a researcher on that spent their career around these sleep aids and melatonin, and framed that when they did a meta-analysis, there was 4 minutes, I think, gained sleep. So share with us, like, what is the truth about melatonin?
So there's a lot of fear mongering around melatonin. It's actually a hormone. It's not a supplement. Right, so you have to think of melatonin like vitamin D. Yeah. Vitamin D is a hormone. And remember when we all of a sudden realized, hey, we all need to take vitamin D, and there was a lot of skepticism around it. So we just don't have enough data around melatonin. The medical grade of melatonin, that is harder to find. There's data that shows that over-the-counter melatonin, over 70% of it sold in the United States is not really just melatonin. So you have to be careful about what type of supplement, any supplement that you take. Right. Again, supplements do not have the same efficacy as prescription medications, generally speaking. And I am not a fan. I actually have a supplement that's out on the market that has 3 ingredients. I'm not a fan of taking a supplement that has 10 or 12 things in it, because then you don't even know what's working, right? And the other piece around supplements for sleep is that supplements for sleep are meant to support what's already working. Right. So they are not going to be medications to help cure what's abnormal. Right.
similar to the medication that you mentioned, right? It might
Right.
just be a support, but it's not, you need to really address the root cause of why you're
The
not
root
sleeping.
cause,
Yeah.
right. And melatonin, there are long-term studies that show that low doses of melatonin taken for long-term is safe, maybe cardioprotective. I mean, melatonin, again, is a hormone. I listen to that same, and I am going to, I'm not a researcher, I'm a clinician. So there's a little bit of a difference,
Yes.
you know, when I'm seeing people in real life and I'm seeing how medications work or don't work, that's it, that's real time feedback to me. And what we do know is that melatonin reduces as we age. So we lose the production of melatonin. So that stereotype that, well, I'm old, so I'm supposed to not get good sleep, that's not necessarily true. Maybe
Right.
it's part of the aging process, but do we need to be hampered because we're aging? Do we need to
No.
be working at half our capacity simply because we're in the aging process, or are there ways to support our aging so that it is we're maintaining quality?
I love so much that you said I'm not a research scientist, I'm a clinician. One of the passion topics I have right now is this, particularly in women's research, health research, where there's such huge gaps, and we're stuck in a position where medical guidelines are decided based on all this quality research of random control trials and grading that research. Um, and so you've got physicians saying, like, no, that doesn't work because there's not enough random control trials. And then you have other physicians saying, well, hang on a second, we do have some evidence here. And here's the pros and cons, and you could try it, and let's tailor it to you. So I love so much that you've acknowledged that and framed it in terms of how you approach things, because I think it's so, so important for women to know that, you know, everybody's different.
Yeah.
And just because there's research showing a benefit for the average population means that you might or might not have the same impact, or right. So thank you so much. I love that.
You're welcome. I think that we have to, the truth is somewhere in the middle.
Mm-hmm.
And we have lost our art of medicine, so to speak, because we focus so much only in randomized controlled trials. But when we really think about it, most of what we treat in medicine doesn't have a randomized controlled trial.
Mm-hmm.
We still have a long way to go if we think about all the things that we potentially treat in the medical world.
Well,
And
and
if we wait for the long-term evidence, especially in women's health, that's not going to be in my lifetime then.
no, and I want to feel good in my lifetime.
Yeah.
As a society, the discourse that, you know, physicians know all and it's black and white, uh, it still persists so strongly. And for the realization to understand that medicine is art and science, and physicians are human beings vulnerable to their own biases, their own training, and their own experiences. And so it could be unsettling as a human, but it really, that's the discourse that people struggle with. Is like, my doctor knows everything. Medicine's black
Yeah,
and white. This is right.
yeah,
This is
medicine
wrong.
is,
And
and
life is
we don't
gray.
know it. Right.
Life is
Right.
gray.
And you know, that's partly why so many women have been dismissed.
Mm-hmm.
So if we remember and realize that women were not even involved in studies until 1993. 1993 is when women were included in all of these published studies that we now use to make decisions. This, in part, my take on that is that is why so many women have been dismissed over the
Mm-hmm.
years, over the decades, because that data doesn't, women present differently.
Right.
So, you know, I can say I'm following, you know, these guidelines, but you know, those guidelines are for guys.
Mm-hmm. Mm-hmm. Exactly.
So, you know, women aren't going to fit neatly into some of those boxes. And so then, well, we don't know what's wrong with you.
Yeah.
Sorry.
And do you see any sort of a subjective question, but like any nuances between men and women as it relates to sleep?
100%.
Yeah,
Yeah, there's a
yeah,
lot of differences. So first of all the screening tools to evaluate for sleep apnea are all gender biased.
of
So the
course.
one that is most notorious is the Stop Bang, which is an acronym. The G is for gender. So you already lose a point if you're a woman. And we know that women in midlife there's up to 50% of women in midlife will have sleep apnea. 90% of them do not know it. So 9 out of 10 women do not know that they have sleep apnea. And guess what? When you Google and look up sleep apnea symptoms, all those symptoms are really focused on men. So the loud snoring, the witnessed apneas, the daytime sleepiness, those are symptoms that we see more often in men. Women present with insomnia, fragmented sleep, migraine headaches. Sometimes they just feel kind of depressed or tired. They've got this chronic fatigue, but they don't generally fall asleep during the day doing things. So, there's not a really great screening tool for women for screening women having sleep apnea. And a lot of women in midlife, one week I had 3 women, regular BMI. No, nobody was obese by
Right.
flawed BMI standards, but regular BMI, all active, all trying to do all the right nutrition things, all had sleep apnea.
Oh, wow.
And none of them had like big, loud snoring.
Yeah.
They were just waking up feeling like tired, like, gosh, I'm sleeping good, the same hours, but I'm just not waking up feeling refreshed. I feel like I'm dragging during the day.
Yeah.
People who went to medical school with me, I don't even remember hearing one thing about sleep and the importance of sleep
Mm,
in medical school. And
mm.
in residency, maybe I think an hour.
Wow.
So when I went and did a fellowship in sleep medicine, I was blown away and realized, oh, well, sleep clearly is actually the cornerstone. So we think about the 3 pillars, diet, exercise, sleep.
Yeah.
And honestly, if the sleep is off, the diet's not going to be great. If the sleep is off, your exercise benefits are not going to be as great. So sleep is really
Absolutely.
that foundational component.
Absolutely. Absolutely. What made you decide to go into sleep?
So I was a practicing internal medicine doctor, and I would, try to manage everybody's chronic medical conditions. And at the end of almost every appointment, people would say, "Oh, hey, I'm not sleeping well. Can I get something for that?"
Mm,
And like a good primary care doctor who didn't know any better, I would write for medications to help
mhm,
them get to sleep.
mhm.
And it kind of hit me one day, like that's all I am doing is like writing prescriptions for sleep aids, or everybody's on like some sort of over the counter antihistamine. And so then I started diving into sleep, and it blew my mind. I
Mm,
thought, oh my gosh, why didn't I learn any of this? And even in my sleep medicine fellowship, I didn't learn anything about melatonin, really, that it reduces, that the pineal gland in the brain that is making melatonin, which is our sleep hormone, that's the first gland in the body to calcify,
mm.
and that we lose the production of it up to 50% by age 50.
Wow. What would you, so for women listening, what would you suggest for them as a sort of next step to be like, hang on a second, am I the 1 out of 10 who doesn't
Yeah.
know I have it, or should I need to figure this out?
Are you the 9 out of 10 that doesn't know
Yeah.
that they have
Yeah.
it? Really? Yeah. Okay. So you really want to start to identify, how many hours of sleep am I truly getting versus how many hours are you in bed? Are you feeling refreshed when you wake up? Do you feel like you have this chronic fatigue that you can't shake? Have you noticed mood changes? Those are some chronic things that I see in my sleep practice. And you want to ask your provider, you know, about, are these connected to not to potentially having sleep apnea? You know, snoring, you know, you can have snoring, it does increase. I'm not saying that people don't have snoring,
Right.
but you don't necessarily have to
Have to
have
have it.
big, bad, loud snoring
Yeah.
to actually have sleep apnea.
Tell us about the dream method and how it
Yeah.
came to be.
Okay, so I started practicing sleep medicine and I quickly became the women's expert on sleep because a lot of women come with non-specific issues, and frankly, nobody else wanted to see them. So I started seeing all of them, and then I saw myself in a lot of these
Mm.
women. I used to be a person who could sleep anytime, any place, anywhere. Got into, perimenopause, and suddenly I was waking up in the middle of the night.
Yeah.
And so I realized that many of us, because of the brokenness of our healthcare system, really in the sleep world, um, we focus on, do we have a medical disorder? And if we don't have restless leg syndrome or sleep apnea or chronic insomnia or there's other sleep disorders, but we can't help you. We don't
Right.
know, so that made me think there's so many components to that affect your sleep. So I developed the dream sleep method because the D stands for your daily activities. What are you doing during the day that might be contributing to your inability to sleep? R is resting environment. How is your resting environment helping or hurting your ability to get to sleep?
Mm-hmm.
E is for emotions. We know that we bring our emotions into the bedroom, stressful days, anxiety, depression. We know that affects people's sleep and the stages of sleep. A is for archetype. So I call myself the sleep goddess, MD, and archetype stands for the different circadian rhythms, or basically when your brain wants to go to bed and when your brain wants to wake up. So either being an Artemis or an early bird, an Aphrodite or a night owl, or an Athena, which is somewhere in between. And then M is for all of the medical conditions that could be affecting your sleep, like sleep apnea, restless leg syndrome, chronic insomnia, any kind of neurological disorder, any kind of autoimmune disorder. These can be affecting your sleep.
Mm. So for women who can't physically get to see you, where can they learn more about the dream method?
So I have a website that really dives deep into the dream sleep method. I have blog posts on there. I also have an insomnia toolkit that is on my website for purchase. And I am in the process of writing a book that will probably it's in its infancy stages, but it's going to be published probably in early 2027.
Oh, fantastic. Congratulations.
Thanks.
Yes. Can't wait for that for sure. Um, and I think you have a lot of work to do. Like you've got to change, like sleep goddess. There's so much work we have to do. So if you were to give one piece of advice to women as to sort of where to start on this journey, what would you suggest?
Start writing things down, like start writing down what your symptoms are, how much sleep you're getting, and know that there is always something you can do to help yourself get
Mhm.
sleep, get
Mhm.
better sleep.
We have to figure out the root cause, not just add
Yeah,
more medicines to our regime.
that's right. That's
Some
right.
of us are walking around with little pharmacies everywhere we go. I remember my grandma used to always come with a little suitcase with all her vitamins and medications. And as a child, I was like so shocked by this. And
Yeah.
it's like, I'm like, what the heck here? I've got my patches, my creams, my pills, and really don't want to add anything on in the area of sleep at all. So you've inspired me and motivated me personally. as a woman in menopause, but also to really raise awareness and support women in this space. It's just, like you said, it's the foundation for everything, really.
It is.
Well, thank you so much for your time.
Thank you.
Hopefully we can chat
This was
again when your
great.
book comes out, or if not
Yeah.
before.
Yeah,
Okay.
definitely.
Okay. Thanks so much.
Thank you.